Hello, and welcome back. In this lecture, we're going to be discussing Chapter 11 and Chapter 12. In Chapter 11, we're talking about working within a context of an organizational structure, right? So, organizational structure. Case management is going to function within a complex organization. You have to follow their rules, structures, and cultures. It's really important that your organizations or your companies or your agencies that you work for provide a structure that allows you to understand who leadership is, what the rules and expectations is, company policies, handbooks, and those kind of things, and the overall culture of the organization. For you to successfully help clients, you need to be in this organization or have a structure from your organization that kind of guides you on processes and procedures that help with the workflow and knowing how to best serve your client and operate within that cultural framework of that organization. So understanding the chain of command is important. It's vital to understand who is supervising you, who's working with you, who what supports are there are present for you as an employee. Because again, you as a healthy case manager and feeling a part of a positive culture and whatnot will impact your work with clients and client care. If you're a part of an organization or a structure that does not, you don't feel connected to, or feel like you're capable of working with, or feel like you count or whatnot, it can impact your level of work life satisfaction and your work with clients. Right. So understanding your organizational structure is vital. So policies and procedures are also very important because they influence your service delivery, right, and your documentation requirements, right. So it's really important that you understand the policies and procedures for documentation, policies and procedures for working with clients, policies and procedures of supervision, policies and procedures of anything that has to do with your role as case manager, right? Because as a group, we're all going to have a collective team efficacy and follow those policies and procedures, so we're all operating under the same processes, right? And this is important for clients because it can, because say a client was to be transferred from you to another case manager or whatnot, they should be going through the same processes with the new case manager that they were going through with you, creating a level of continuity, right? So organizational culture impacts client interaction, staff roles, and interagency collaboration. Again, organizational culture is again a set of rules, expectations, and beliefs shared by a group of people. So we want to make sure that those beliefs and those behaviors and that culture is shared and is going to be reflected throughout all the staff members and whatnot, so the client can be a part of that um, have part of that positive chain of interaction and that positivity within that culture. So ethical dilemmas, they often arise, especially in organizational contexts and whatnot, because again, there's different situations, and we want to do what's best for the client. And sometimes some of the policies and processes might not be best for that individual client, right? Which can create an ethical dilemma that you want to be able to process with your supervisor. Supervision becomes very, very important when it comes to dealing with these ethical dilemmas, because again, you're consulting someone that's it's in a supervisory role to actually help you to navigate through that dilemma for the best interest of the client. So, organizational rules and dynamics. So, case managers may work with an interdisciplinary team, including clinicians, administration, and support staff. And it's really important that you work on an interdisciplinary team because every member of that team plays an important role in the holistic care for that client, treating the whole client, all aspects of the client, right? And your role as an advocate, and your role as a linkage of resources, and your role as an individual that is going to help the client navigate through those systems and whatnot is vital, and it plays a huge role in that team, right? So role clarity prevents service duplication and enhances accountability. So again, we don't want the clinician and the case manager to be working on the same linkages to referrals or resources. We want everyone to have their own role, so there's no service duplication. So everyone can focus on their lane with their client, providing that holistic care that's going to treat their client. So organizational support. We're talking about it impacts the case manager burnout. It impacts job certification. So we want an organization that's going to actually support you throughout. Going to help you to actually navigate the complexities of being a case manager. We want one that's going to understand that you need time off at times. That you're going to need to be able to have certain levels of professional development to help you manage your roles and whatnot, balance out caseloads, and increase job certification. Certification. Also, we want communication and feedback systems. We want you to be able to provide feedback on certain things with the agency and influence. And also in terms of your client, you want to be able to influence advocacy and client outcomes and whatnot, providing feedback for your client and communicating with the interdisciplinary team and the organization on what the best needs for the client is. So in chapter 12, we're talking about the case manager professional growth and development. So throughout your time as a case manager, you're going to develop as a professional and grow in certain areas and grow with the ever changing world. Remember, technology is becoming more and more prevalent through all positions in treatment, right? And you're going to want to be able to grow professionally throughout your time as a case manager. So professional development, again, that is a lifelong learning process. It's essential to changing policies, practices, and clients' needs. Like I said, ever changing world. The world's forever changing. There's always something happening in the world that can change the way we approach our clients, approach our business, new rules and regulations, right? So you want to be a lifelong learner and keep up with those things. You also should be seeking professional development through training, workshops, and certifications. I make a point to go to 2 or 3 conferences a year and freshen up on my clinical skills and freshen up on any new evidence-based practices or treatment modalities or interventions that can be helpful for my work with clients, right? Keep me up to date with my certifications and things I need to do to remain an effective counselor. So supervision and reflective practice. So supervision again is really important because it plays a key role in your skill development and ethical decision making. Having a supervisor that you can actually discuss things with and process things with and get different interventions and tools with and work on making the best decision for those ethical scenarios is very, very vital for case managers, right? Self care is also critical to prevent compassion fatigue. And again, that's part of the supervision process as well. Where supervisors should be helping you and make sure you are maintaining a regimen of self care because again, we can take things on from our clients and put the load of our clients issues or whatnot on ourselves or whatnot as we become because we got into this field as people that wanted to help in the helping profession, right? So it's important that we balance out and take care of ourselves, right? And reflective practice enhances professional identity and service quality. So again, we want to be able to reflect on our practices, enhance our professional growth, learn new tools and strategies, and strengthen up whatever practices that we have through reflection and through consultation and supervision. So here's some strategies for professional growth. You want to set short and long term goals. Again, set short term goals are is that learning process of setting goals that you want to achieve over a short period of time. And long term career goals are things that you want to do throughout your career again to see how to make sure it's going in a certain direction, right? So joining professional associations like NASW or CMSA, right? Those are geared towards case manager or social worker and whatnot to help create those avenues for conferences and professional development and just being amongst a group of shared experiences or people, like-minded individuals that again have a certain culture because case management is and social work is a culture, right? Is a culture, a set of shared beliefs, sets and values shared by a group of people, right? So you want to engage in reflective journaling and peer consultation. Reflective journaling is the reflection on your actions and what you're going through, your feelings and emotions, right? And consulting with peers. And you want to advocate for organizational support for ongoing learners, right? So you want to make sure that you are always advocating for your organization to support you and to continue your learning. You also want to embrace feedback as a tool. Sometimes it's really hard to get feedback because feedback sometimes can be very direct towards you or whatnot. It can reveal things about you that you don't agree with from other individuals or whatnot. But again, the ability to be professional and take that feedback to use as a tool to get better is always a concrete skill to have as a case manager, clinician, or just a professional.